Hello everyone, my name is Precious Idogan. I am a PGY2 internal medicine resident at Sarasota Memorial Hospital, Florida State University. Today, I will be presenting a case titled Red and Angry, Hemorrhagic Chemosis Associated with Isatuximab Use. Isatuximab is the most recent anti-CD38 monoclonal antibody approved for treatment of patients with advanced multiple myeloma who have failed or completed first lines of treatment. Infusion reactions happen quite often and can be severe or life-threatening. We report a case of a 75-year-old female who presented to the emergency department with rapid onset unilateral hemorrhagic chemosis that was associated with the initial infusion of isatuximab. The patient is a 75-year-old female with a history of multiple myeloma with amyloidosis and light chain nephropathy, which was diagnosed in 2019. She presented with complaints of right eye erythema, pain, and swelling. Earlier on the day of presentation, the patient had been started on fourth-line therapy for multiple myeloma with isatuximab, carfilzomib, and dexamethasone. The patient had received an initial infusion in addition to 20 mg of dexamethasone and Benadryl. She had then waited for 1 hour with no reaction before another infusion of isatuximab was started. Within 10 minutes and after approximately 85 milliliters of isatuximab had been infused, the patient developed rapid erythema of her right eye that was associated with pain, foreign body sensation, swelling, and burning. There was proptosis of her right eye with marked hemorrhagic response. The left eye was unremarkable. Visual perception of the right eye decreased to light perception only. Following this development, a cold compress was applied and the patient was then sent immediately to an ophthalmologist for further evaluation. She was instructed by the ophthalmologist to then present to the emergency department for further imaging studies. On arrival to the emergency room, initial vital signs were temperature of 97.3 degrees Fahrenheit, blood pressure of 103/61, heart rate of 73 beats per minute. She was saturating 100% on room air and breathing at a rate of 18 breaths per minute. Physical examination at the time of hospital admission, which was approximately 10 hours from when the infusion was stopped, showed a well-appearing elderly female in no acute distress. The right eye exam showed proptosis and hemorrhagic chemosis. However, the visual fields were intact and the pupils were equal and reactive bilaterally. Visual acuity was measured at 20/50 bilaterally. Other components of the physical examination were largely unremarkable. A laboratory workup including complete blood cell count and liver as well as kidney profiles were largely unremarkable, only demonstrating non-chronic kidney disease. She also underwent MRI of the orbit and CT scan of the head, which demonstrated no evidence of intraosseous or extraosseous plasmacytoma. The patient was subsequently monitored in the hospital for 24 hours before she was discharged. Upon discharge, she continued to have visual acuity of 20/50 in both eyes. She had 4+ conjunctival hemorrhage for 360 degrees around the right eye. Her proptosis had also resolved, and she had full extraocular movements. Multiple myeloma is the third leading hematologic malignancy. It is characterized by bone marrow infiltration with clonal plasma cells. Advances in molecular biology has led to the identification of aberrant proteins in cancer cells that are good targets for cancer therapy. Current targeted agents exhibit the same frequency and severity of toxicities as traditional cytotoxic agents, with the main difference being the nature of the toxic effect. Thus, the classical chemotherapy toxicities of alopecia, myelosuppression, nausea, and vomiting have generally been replaced by vascular, dermatologic, immunologic, ocular, and pulmonary toxicities associated with targeted therapies or monoclonal antibodies. These toxicities need to be recognized, prevented, and optimally managed. Ocular adverse effects have also been reported with different immunomodulatory agents in the management of multiple myeloma. However, these are usually rare. In conclusion, the patient had an ocular infusion reaction from isatuximab despite premedication. Given its relative novelty, it is important to continue to monitor and document reactions of this kind in order to increase information and accurately inform patients and recipients of the drug about the full safety profile and potential side effects of the medication. Thank you.